Hey everybody, it's Dave Juno. How y'all doing? I'm doing pretty good for a Thursday. We've talked in the past about how Meniere's is diagnosed, and the testing and all that. Now I'm not going to go over all the testing because we've been through it before. But I think one thing that I haven't really talked about is the CT scan. Okay, so basically CT scan, it's a really easy scan. You're not going into a tube like the MRI. So there's really nothing to be super afraid of. They're not that loud. It's like a X-ray. It goes like this. Just close your eyes. Um, but it's not that bad. It's easy peasy. They do it. You're done. But what they're looking at is your temporal area, and they're looking for to see if there's an acoustic tumor, acoustic neuroma on your vestibular nerve or your acoustic nerve. And I say both because the nerves are always like this. They're right on top of each other. I mean, you could have one right in the middle. Um, and you get the same symptoms that you would with Meniere's: hearing loss, deafness. Well, maybe not. Yeah, deafness, tinnitus, vertigo. You get the same type of symptoms. So that's what they're trying to limit. Make sure it's not that. Um, and it's very simple. Like I said, you lie on a bed, they push you in. It's not a tube. It's like a donut. It's like a giant donut. And you hold still for a couple of minutes and they pull you out and you're done. Easy peasy. In the MRI, they're really looking to see if there's any other tumors, like a glioblastoma. And because a lot of those symptoms for that is vertigo, off balance, dizziness. I don't know about the hearing loss and the tinnitus, but I know my cousin Rob, God rest his soul, died last year from the glioblastoma, and he was getting vertigo. So they're looking for things like that, other things that might be causing it, like maybe MS or things like that. So, but we're going to talk about the CAT scan. I'm talking about the CAT scan specifically because earlier today I saw somebody said I don't think my doctor has seen my CAT scan, my CT scan, and I look at it and I can't see anything. There's got to be something in my head. Well, one is you don't know what you're looking at. Okay. Um, you're looking at something you've probably never seen before. And if you're not trained medically, you wouldn't even know what I mean when they write the report too, you probably wouldn't even know what they were saying. So, that's kind of one of those things is have patience, let your doctor figure it out and let him tell you what's going on. Don't get all upset, okay? Because I could look at your CT scan and I wouldn't know what the hell was going on. I'd be like, what the hell is this? you know? Um, and the same thing with the MRI scan. You know what? Earlier today, because Epic updated my chart, so now you can see your X-rays and all that stuff. I went to my brain MRI, and I've had like I don't know, 5 or 6, and I went to one of them and I was looking at it, and like, wow, this is cool. I can see my brain. I can see the top part. I can see the back part. I can see the side. This is awesome. Oh, look, there's my eyeballs. And I'm like, I know where my eyeballs were, but I'm looking at it. I'm like, I don't know. I see all this other crap on here. Like, I don't know what the hell that is. Then I remembered. Oh yeah, that's from I get white buildup from migraines. Blood vessels popping from migraines. And I'm like, oh yeah, I remember that. I remember what they told me, but if I was just looking at it and not knowing that, I would have been like, oh, what the hell that is. Maybe everybody's brain's like that. I feel okay. And I would have waited for the doctor to tell me what was going on. So, yeah, be patient because they're actually helping you. If you have an acoustic neuroma and they find it, the CAT scan and an MRI, that's easy peasy. They knock you out, they cut behind the ear, they go in to where the nerve is, get the tumor, clip, clip, done. Those tumors, like I've said before, they're 95% benign. Very rare that they're malignant. So you just go in, clip, clip. You might have hearing loss, or you might actually be deaf. I've had 2 friends who've had that acoustic neuroma, and 2 of them are deaf. on that side. They wear cross hearing aids. One was looking into a cochlear implant, but I guess he decided not to, and that's fine. You know, um, I mean, really, one of my big things about the cochlear was I needed to hear what was going on, like where sounds were coming from, because I got back when I had it, it was 4-year-old grandson who's autistic, and his is you never know where the hell he is unless you can hear him. So I was like, okay, that's why I'll get it done. Um, so yeah, that's one of the things that can happen. But if that's it, you're lucky. That's great because you won't have to deal with steroid shots or taking pills or taking supplements, possible more surgery. Like I had a laparoscopy done on this side. On this side, I had the sac decompression surgery, and they had to do it a way different way. They had to do it way different because of my anatomy. And they found that out with, guess what? The CAT scan. Okay, the CT scan. They found that out with the CT scan that my anatomy is different. The nerve ran differently, so they had to be very careful not to hit the nerve, and they were awesome. Dr. Chari is an awesome surgeon. So that's why they do the CAT scans, you know. And you know what? If you do end up having Meniere's, don't be surprised if you want to get the sac decompression or you want to get the laparoscopy done. Don't be surprised you got to do another CAT scan, another CT scan, and another MRI, just to make sure nothing changed. Okay, so that's what a CAT scan is. And if you don't know what you're looking at, have patience. Contact your doctor. Don't post in a Facebook group because you're going to get 100 different people saying, "Oh, let's see it," and then they're going to try to diagnose it, and you're just looking for a world of stress, really, because everybody's different. You're going to get the person who, "Oh, I was a former nurse for 20 years," and or a nurse's aide for 20 years. Let me see, and they don't know what they're looking at. I don't care what they say; they don't know what they're looking at. Or the people who think that they're doctors because they do research or whatever, they really don't know what they're looking at. So talk to your doctor, wait for your doctor, make a plan with your doctor, and go from there. And on that note, I'll talk to you all later. Bye.